Hi guys, Dr. Alex Earl here again. Just wanted to talk about my role, and I work at two sports medicine departments up in the Chicagoland area. One is a high school where I work with where I'm integrated with the athletic training staff, some of the local overseeing physicians on cases, as well as I work at an undergraduate university in Chicago, and it's really a unique and an interesting setup. Because I'm integrated into the care. I'm part of the treatment plans for the athletes, part of the assessment, part of the diagnosis, the protocols, all of that. And that's really where I see the future of chiropractic heading, is being fully integrated into sports medicine care at all levels, ranging from the elite, the Olympics, all the way, which it already is, but ranging from the elite and the Olympic athletes that we have, all the way down to high school, middle school, and youth sports, because it's quite an opportunity for chiropractors to be involved in athletic events. I mean, they go hand in hand. Musculoskeletal care, dealing with the injuries that happen with on the field injuries, treating them really well with non-surgical, non-pharmaceutical interventions. But the reason I feel that chiropractors are set aside from it is because to be truly patient-centered is to have all the tools on your tool belt, but to know when to pull each tool out for each specific patient. In which case, chiropractors should be, the leading experts in the field to identify which tool belongs at which time and with which patient for the specific results that you're seeking. Because what I've seen in the physical medicine realm is that the provider's techniques or the provider's approaches fit the circle or fit the realm, and the patient has to be, and then as a result, the patients have to be integrated into the approaches or the therapies. And sometimes the two don't always collaborate, and so that's sometimes where patients leave and they're dissatisfied, or maybe providers think they provided a really awesome service, but then the results weren't there. And so what I try to do is I try to meet the patient where their expectations are and where their needs are, and most of that comes through rehab and through patient education. But to be integrated into a sports medicine department is truly an honor, and I don't take that lightly. I know that it's quite an opportunity, but I also want the community that I'm around to be fully aware of what I can offer, and also the type of provider that I am. And then as a result, I hope that as a whole, the chiropractic profession is raised just 1%. If it's raised 1% in my lifetime, I would be really happy, because then 30, 40 years from now, if every year chiropractors are getting 1% better, then I think that they will be, and they should be, the go-to for musculoskeletal care across the U.S. and across the world.